DMAE has been shown to boost alertness, focus, memory, and mental clarity. DMAE, or dimethyl aminoethanol, has two metal groups, and it's structurally similar to choline, which is a direct precursor to the synthesis of the neurotransmitter acetylcholine. Acetylcholine is a critical neurotransmitter, and it influences everything from memory to muscle control. And it's the relationship that acetylcholine has with DMAE that generates most of the hype around DMAE as a nootropic. It turns out that DMAE is not a precursor to acetylcholine, as has been reported. However, many users report supplementing with DMAE has worked wonders for their brain. DMAE helps to eliminate lipofuscin and free radicals from our brain cells. DMAE prevents choline uptake by the cells, forcing more free choline to be available in your system. And DMAE stimulates cholinergic receptors, and this can promote the use of acetylcholine in your brain. DMAE supplementation can improve mood and energy while influencing sleep patterns. DMAE is an amine naturally produced in small amounts in your brain. High levels of DMAE are also found in seafood like anchovies and sardines. Researchers have speculated that DMAE can increase acetylcholine levels in the brain by inhibiting choline metabolism in peripheral tissues. By preventing the use of choline by other tissues, including synthesis into acetylcholine, DMAE increases the choline levels in the bloodstream. Once DMAE crosses the blood-brain barrier, it increases choline levels in the brain. So at higher choline levels present, you'd expect elevated levels of acetylcholine. But research has shown this is not always what happens when DMAE gets to your brain. In one study, the DMAE was rapidly taken into the brain, but when it reached the synapses, nothing happened. Choline levels rose, but they did not convert into acetylcholine. Acetylcholine is synthesized in a single-step reaction that's catalyzed by the enzyme choline acetyltransferase. The rate-limiting step in acetylcholine synthesis is the availability of choline and acetyl coenzyme A. The only other source of acetylcholine is synthesization from phosphatidylcholine via phosphatidylethanolamine N-methyltransferase. And this acetylcholine synthesis only happens in cholinergic receptors. So it would appear that DMAE cannot be converted to either choline or acetylcholine. The only way DMAE can increase choline is by inhibiting choline metabolism. And the reason why choline levels rise in the brain when supplementing with DMAE is because the choline does not synthesize into acetylcholine. So why do some users experience a benefit in increased focus, clearer cognition, and even an antidepressant effect with DMAE? It could be that DMAE stimulates cholinergic receptors into taking action, and with extra choline floating around because of the DMAE, these neuroreceptors may decide to produce some extra acetylcholine. DMAE may be useful for people dealing with a choline deficiency in the brain, and studies show that DMAE's effectiveness in the brain depends on the health of the cholinergic system. But as users, we have more efficient options available for boosting acetylcholine. Centrophenoxine is a combination of DMAE and CCPA, and this seems to boost acetylcholine in the brain much more effectively than DMAE. Lipofuscin is a cellular waste product and it accumulates in the brain cells as we age. It's the same waste product that causes brown spots on the skin. Lipofuscin hides in the cells throughout the body, including your brain, eyes, liver, kidneys, heart, adrenals, and nerve cells. Users often report supplementing with DMAE produces enhanced vision. This vision effect may be DMAE's ability to help to remove the waste like the lipofuscin from cells that affect vision. The lipofuscin removal mechanism of action by DMAE has been shown in animal studies. Researchers used centrophenoxine injections on a 17-month-old female mouse. The animals were injected daily for 3 months. The researchers studied the changes in the pigment layers of the retina of both eyes in the mice, and they found there was a significant reduction of lipofuscin pigment in the treated animals. Centrophenoxine breaks down into DMAE once in the body, and it's the DMAE in this nootropic that provides the lipofuscin scavenger effects. DMAE has been reported by some users to improve vigilance, attention, mood, and energy, while alleviating depression. A study by German researchers may explain where this feeling of well-being comes from when supplementing with DMAE. This double-blind, placebo-controlled trial used 80 human subjects, evenly split between male and female. The study analysed their brain's electrical reaction during the presentation of 5 7-minute video clips, followed by 3-minute pause after each. This procedure was repeated after 6 and 12 weeks of daily intake of DMAE or placebo. The subjects who were taking DMAE for 3 months developed significantly less theta and alpha brainwaves. Decreases in theta and alpha brainwaves have been associated with increased vigilance and attention. The subjects using the DMAE were also more active and felt better. The researchers concluded that the DMAE can induce a state of better feeling and well-being. As we get older, our brain chemistry and our energy metabolism changes. Concentration, working memory, and executive function decline. Cholinergic receptors degenerate. DMAE levels decline. Lipofuscin and free radicals build up in the brain cells. All of these age-related changes could be influenced by declining DMAE levels, and they're contributing factors to neurodegenerative diseases and depression. DMAE levels declining are an inevitable consequence of aging, and they may contribute to the onset of degenerative disease. DMAE increases choline levels in the brain. This increase in choline and DMAE's ability to stimulate cholinergic receptors into action can lead to an increase in acetylcholine levels. But DMAE does not directly elevate acetylcholine levels in the brain. DMAE is not a precursor to acetylcholine. Increased acetylcholine levels affect learning and memory. Acetylcholine helps the encoding of memories and our ability to concentrate. As users, we absolutely want to increase acetylcholine levels, especially if our brain is low in acetylcholine. DMAE is not the best way to achieve the goal of elevated acetylcholine. Research into DMAE is ongoing, and there may be some benefits to DMAE supplementation not yet known by the research community. It's been used to treat a variety of conditions from cognitive disorders to ADHD. DMAE is also used in skincare products to help to reduce age spots, fine lines and wrinkles, and even sagging skin. Free radicals can cause damage to DNA. It can upset cellular metabolism and induce the creation of oxygen species that kill brain cells. Some research has found DMAE is somewhat effective as a free radical scavenger. It's been found to diminish the extent of cross-linking of proteins that's been implicated in diseases like Alzheimer's. Researchers think this may be due to DMAE's effectiveness as a free radical scavenger. Some users report DMAE supplementation causes a noticeable boost in their ability to concentrate. They often report better memory, especially short-term memory, mental alertness, improved focus, mental clarity, and better sleeping patterns. Dosing more DMAE than recommended has been reported to make you feel edgy and tense, and you may experience muscle spasms, particularly in your shoulders and neck. A prescription form of DMAE called Dianol was in clinical use as far back as the 60s and the 70s. Dianol was used for the treatment of learning and behavioral problems associated with shortened attention span. 2 clinical trials conducted over 40 years ago provide evidence of the efficacy for using the DMAE for treating what's now known as ADHD. In 1983, the FDA, in all their wisdom, insisted on additional studies to prove the effectiveness of DMAE, and because clinical trials would have been costlier than product sales, the company making Dianol took it off the market. DMAE is now available as a nootropic supplement, one that your doctor or psychiatrist is unlikely to prescribe to you for treating ADHD. One double-blind, placebo-controlled study compared the effects of DMAE supplementation with Ritalin for treating ADHD. 74 children diagnosed with learning problems and hyperactivity were referred to the study. The children received 40 milligrams of Ritalin, 500 milligrams of DMAE, or placebo every day for 3 months. Behavior, reaction time, and other psychometric tests were done before and after the treatment. Both drugs proved to be effective according to several tests. The researchers concluded DMAE supplementation significantly improved performance in children with learning and behavioral disorders. Another study conducted by Dr. Carl Pfeiffer at the Brain Biocenter in Princeton, New Jersey, with 25 girls and 83 boys, found similar results in using DMAE for treating ADHD. In this study, it was found DMAE enhanced the behavior in 2/3 of the boys and 3/4 of the girls. Attention span was better. Irritability and hyperactivity were decreased. Scholastic ability improved, and in some cases, even the IQ got a boost. So if you have ADHD and you're using Ritalin or Adderall and looking for natural alternatives, you might want to try DMAE. Most of the research on DMAE from the 50s and the 60s centered around using the compound for cognitive function and brain health, but the most recent research is now testing it in skin cosmetic formulas. It's been shown to increase skin firmness even in young skin. One study on 30 healthy adults aged 36 to 49 applied a DMAE gel or placebo, and the results of the study showed the DMAE treated skin was much firmer. Another randomized clinical study used a 3% DMAE facial gel applied daily for 16 weeks. The gel was able to reduce forehead lines, wrinkles around the eyes, and improve lip shape and fullness, and the effects did not regress even 2 weeks after stopping the application. Another open-label extension of the same trial showed long-term application of DMAE gel had a good safety profile. A recommended dose of DMAE is 100 to 200 milligrams per day. DMAE nootropic supplements are usually sold as DMAE bitartrate. A capsule of DMAE bitartrate is only 37% DMAE, and the rest is 67% tartaric acid. A 250 mg capsule of DMAE bitartrate yields 92 mg of actual DMAE. Take your DMAE dose in the morning before or with your breakfast. Dose the DMAE a few times a week, but not every day. If you're going to use DMAE, stack it with a good source of choline. Remember, DMAE inhibits choline and the metabolism of choline, and you absolutely need choline and acetylcholine for a fully optimized brain. DMAE inhibits phospholipid synthesis. This means you won't get much help with choline precursors, so you need a good source of choline. Without getting into a long explanation of the mechanics, phosphatidylcholine or CDP choline and omega-3 can help to offset the damage caused by long-term DMAE use. DMAE is considered non-toxic and safe for short-term or intermittent use. Your body naturally produces some DMAE on its own. You shouldn't experience any side effects as long as you use the DMAE in recommended doses. Some users report insomnia, headaches, and muscle tension, usually because the dose was too high. If you have a negative reaction to DMAE, stop using it. If you're planning on becoming pregnant, do not use DMAE. Clinical studies have shown that DMAE can stunt the growth of a child's brain. If you have epilepsy or bipolar disorder, you should avoid using DMAE entirely. Your body does make some DMAE on its own, but DMAE production inevitably declines with age. Some users report using DMAE has a significant effect on concentration, memory, alertness, focus, and mental clarity. If you're going to use DMAE, start with 50 milligrams per day and see how you feel. Increase the dose no more than 50 milligrams at a time and watch for side effects. And don't forget to cycle it. Take it for a few days and then take a couple of days off. For more information about herbs, supplements, and natural treatment plans, check out my website.